Good afternoon. Thank you so much for being here. My name is Kim Ann Win, and I'm the President and CEO of Blood Bank of Hawaii. I want to thank you all for joining us today, and I want to give a special thank you for Lieutenant Governor Josh Green for joining us today, and two of our esteemed guests. First, Pastor Gladys Tupulua, who is from the Samoan community at New Creation Church in Waianae. Thank you so much, Pastor. And also Filios Urman, who is the contact tracer for the Chukis community and the Micronesian community from Department of Health. Welcome, Filios. Thank you so much. My friends and family in the Hawaii community, I can't believe that we started at Blood Bank of Hawaii collecting our first dose of convalescent plasma as part of the Hawaii Convalescent Plasma Coalition just at the end of April. It's been 9 months. And at that early stage, we didn't have a lot of information about convalescent plasma. What we knew was that the United States of America was heading into a pandemic, and it was about to hit Hawaii, and we needed to be ready. And opening up the new year, 2021, it's hard to believe that it has been 9 months since the Hawaii CCP Coalition has been in operation. So what's happened during those 9 months? I'm happy to report to all of you that the coalition has treated almost 1,300 doses of convalescent plasma has been transfused into Hawaii's patients. That's 11 hospitals, 1,300 doses. And at a savings of close to $800,000 to the hospitals of our community. So that's an incredible impact to Hawaii. In August, the Food and Drug Administration granted emergency use authorization for convalescent plasma. And those were the early days. So you may ask, Dr. Wynn, why today in 2021 are we talking about convalescent plasma? So there's a big reason for that. And that is, as you all know, we are being hit very, very hard. The pandemic is now at the worst that it's ever been. And as our leaders have told us, the worst is yet to come before the light at the end of the tunnel is going to hit. And that's why I come to you to ask for your help and to launch a new initiative here. We're being hit with the triple threat. First of all, as you know, with the rise of several variants that appear to be more transmissible, we run the risk of greater number of cases of COVID-19 even in our community. So that means more people getting COVID-19. More people getting COVID-19 means potentially more hospitalized patients. So that's a hit to our community, number one. Number two, what is in our toolkit for hospitalized patients when they are sick with COVID-19? We need in our community every single tool in our toolkit in order to treat COVID-19 patients. And right now, we have monoclonal antibodies, we have hyperimmune globulin, but we also need convalescent plasma. In addition to remdesivir, we need every tool in our toolkit. And to be honest, we simply do not have enough donors of convalescent plasma. Throughout the United States, every week, about 30,000 doses of convalescent plasma are being transfused. And right now, the United States stockpile of convalescent plasma has pretty much been depleted. And so the Surgeon General has put out an appeal for donors of convalescent plasma. Fortunately, here in Hawaii, we still have a local stockpile, but we can't let that get depleted. And so we are here in Blood Bank of Hawaii announcing a new initiative. We call it Fight COVID with COVID. And this new initiative is to find new donors so that we can keep our local repository strong. Where are we going to find these super donors, superheroes? Looking at where it's hit us the hardest. Now we know that 2/3 of the COVID cases have hit our minority populations. That's in our Micronesian Pacific Islander population, our Filipino population, and our Native Hawaiian population. That's really tough. But on the other side of it, the flip side is that that's where our recovered patients come from, and that's where we find the heroes. Those that have recovered that can help us fight COVID-19. So I'm here today to announce our new initiative, Fight COVID with COVID, and I'm here proudly standing next to our new allies in this new initiative to ask those of us who have recovered from our communities to roll up your sleeve and come forth and help us in this fight and donate your convalescent plasma so that we can treat our hospitalized patients and get them out of the hospital and help us to keep our health system open and allow us to continue to recover as a community. So I'd like to ask Lieutenant Governor Josh Green to come up and say a few words. As you all know, Lieutenant Governor Josh Green himself is a COVID survivor, and he was one of the first coming right out of his recovery to raise his hand and say, I want to help. And I want to thank him for being a hero and a supporter of the coalition. And he needs no introduction, but Lieutenant Governor, thank you.
Thank you, Dr. Nguyen, Pastor Colonius. Good to see you guys. Just a couple brief comments. So first, let me thank everyone who's watching, paying attention here during the COVID crisis, because the Blood Bank of Hawaii saves lives on many levels. In this particular case, it's through COVID convalescent plasma. And let me remind people what that is. After you've had COVID, I had COVID in September, your body builds an immune response. You get antibodies to it. And those antibodies can then be collected by giving plasma, a plasma donation, and then that can be used for patients, and that will save lives. So in this particular case, we're saying, please everyone, consider, if you've had COVID, consider coming and donating convalescent plasma. It's vital to saving lives. Now these folks have come up with a very interesting way to express this challenge, and that is to fight COVID with COVID, not unlike fighting fire with fire. And it's really an important thing to stockpile the CCP, that's the COVID convalescent plasma, because we don't know when we're going to need it very badly. Over the last few weeks, we have seen a surge after the holidays, after Christmas, after New Year's. Very understandable that we wanted to see our loved ones, that we got together in gatherings because we've been isolated, and that's hard too. But because of that, we saw a big jump in the cases, and we got up to 322 cases the other day. Now it started to come down, and that's good. But the bad news is that over those 3 weeks, we had an accumulation of people that got sick. And those people who got sick 2, 3, 4 weeks later may very well end up in the hospital. For every 100 people that catch COVID and we test them positive, 7.5 to 8 people end up in the hospital. These are our brothers and sisters, our moms and dads, who can then get treatment from this convalescent plasma. So after a few weeks, after you've had COVID, you have an opportunity. You've survived. You have an opportunity to give back and help others survive. What I expect from this 2,200 people that have caught COVID over the holidays is 150 additional patients here at Queens or Hawaii Pacific Health, Castle, throughout the hospitals in our state, Kaiser. They will need your help. and you can save their lives by coming and donating CCP. It's especially important that we reach out because we have had a wonderful group of people, about 200 people donate CCP. 80 of them have donated on several occasions. But that's just not enough for us long term. We're going to get out of the COVID crisis in the coming months, but it's going to take time. We've begun to vaccinate people. That will keep people safer, but that doesn't mean there won't be cases of COVID. It doesn't mean there won't be people in the intensive care unit. We have had so many stories. Some have been lucky, like me, just a very mild case of COVID. Others, people dear to me, severe cases of COVID, and it is very possible they can pass away. A dear friend of mine who was 51 years old on the mainland did die of COVID. And had we had treatments in the early days, this had not been approved yet, we might have been able to save Nick is his name, his life. So I wanted to give you that perspective. The additional thing that you have to know is that now that we're vaccinating people, it adds a wrinkle to this process. As I said earlier, if you catch COVID, 28 days later, if you're feeling well, you can donate CCP. We can then have it. But once you've been vaccinated, you can't be a donor any longer. You can come here and do other great things. You can come and donate blood. We'll save lives. You can donate regular plasma. I intend to do these things repeatedly, like many of us should. But you can't donate CCP once you've been vaccinated. And we're going to ramp up the vaccination process very quickly. So my appeal to you is this. If you've had COVID, if you are willing, please come down here and donate CCP. Please make that commitment to save other people's lives. Again, we've had these wonderful people so far donate, but we have 2,000 people right now with COVID that could come down. We've had 23,000 cases of COVID in our state over the last 9-10 months. All of these individuals are able to donate. Now it's a commitment, I know it's scary, but I'll tell you, it was nothing. It was 45 minutes or an hour, I didn't feel a thing. They were very kind to me down here. They're so sweet, you can't even believe it. It makes you want to come back again because you'll be saving lives and they will definitely help you do that. As an ER doctor, I've seen how many times it can make a difference. Every time we diagnose a case in Hawaii, I imagine how we could save that person. You never know who's going to need it the most. So please, as a CCP donor myself, I'm asking you, consider this. Consider giving back a gift of life for someone who probably is much older, probably much sicker, but definitely can be saved by your gracious gift. It's also National Blood Donor Month, so let's not forget that either. Just in the last couple weeks, my family had an experience where someone in our building was tragically attacked. That person needed multiple units of blood. She got that blood because of the work here. It is just extraordinary, the things that this organization does to help all of us in Hawaii. So I think what we can do is give back just a little. So I would say this, Happy New Year. It's a new year for us to look forward. We're getting to the end of the COVID crisis, but some people will still have it this year in spite of all of our efforts, and you can save their lives with a donation. Aloha.
Aloha. God is good. My name is Pastor Gladys Tupulua. My husband and I pastor a church on the west side of Y9. The name of the church is New Creation Church. I want to just share a little bit of myself in regarding to COVID-19. In October 28, 2020, I was diagnosed with COVID-19. I was hospitalized for only 5 days, but I thank God my faith was strong. Unfortunately, there are many today that are affected by COVID-19. Some have died from it. Many are still struggling to get better. You may know them as family, friends, co-workers, or by hearsay. We know it's a pandemic that's going on all over the world today. Maybe you have been diagnosed with COVID-19 like I have. And thank God I'm doing well, and you are doing well as well, and in good health. Praise God. If so, this message is for you. Congratulations, you are a solution to this problem. Hallelujah. This opportunity came to me unexpectedly just yesterday, and the word that prompted me to step out in faith was in Romans 8:28. And we know that all things work together for good to them that love God. So I pray that you will find it in your heart to come out and be a part of this great cause. If you had virus and you are well, you are doing well, come out. Be a donation of this blood. It's very much needed and appreciated to fight this good fight over COVID-19. Sincerely from the heart, Pastor Gladys Tupulua. Thank you.
Tiro lang, tiro put, tiro wami aramas minisin. My name is Filios and I'm a contact tracers and monitor with the Department of Health. I would like to share a Chugis proverbs. It says, "Ang aramas takangang," which translated, "The strength of our community lay in the many hands put together. The work is the people." And that is our role as contact tracers at Department of Health. We are here to support the community, to provide resources for the community, especially those who are tested positive for COVID-19 and those who are close contact to those who are tested positive. So when we call as contact tracers, we collect information to help you and your family, to provide food, to provide isolation hotels, or to make sure that you are in a safe place to while you're in isolation and quarantine. In support of this new campaign, Fight COVID with COVID, we are encouraging the community, if you had COVID-19, please donate plasma. It's safe, easy, and Blood Bank of Hawaii staff will be happy to help you. Thank you.
Thank you so much, LG. Thank you, Pastor Gladson. That was a wonderful testimonial, and thank you so much for telling us your story, Filios, as well. I'm happy to take any questions.
Okay, we have Tiffany the Masters, Big Island now. You can go ahead and unmute yourself and ask a question.
Hi, can you hear me?
Yes, loud and clear.
Great. I was wondering how someone from the Big Island could participate in this campaign, since I know the blood bank comes only periodically to the outer islands.
So that's a great question, Tiffany. And in the beginning, there really wasn't an easy way. Currently, Blood Bank of Hawaii does do blood collection drives on the major islands once a month. And so we do plan these drives, and we do collect convalescent plasma on our neighbor island drives. And so I know for a fact that we have convalescent plasma donors, heroes, from our neighbor islands. And so I'm looking at all of you who are survivors, recovered from the neighbor islands. Please go to bbh.org, and on our main website, please click on the COVID-19 page, our CCP page. And when we come out to your island, we'll be happy to work with you. But so the answer is there will be opportunities for you. And many of us who live on the neighbor islands do have family and friends on Oahu as well. So even before we come out to the neighbor islands, there are opportunities for you to call up your family and friends and say, why don't you go to bbh.org and become a donor yourself? But great question.
And Tiffany actually had a follow-up question. You can ask it, Tiffany.
Yes, I was wondering if you actually had stats currently of how many CCP donors there have been on the Big Island so far.
good question. I don't have them at the top of my head, but we can definitely provide them
You
to
are
you.
muted.
May I?
Yes.
Well, I'll just say I still consider myself a Big Islander, and I donated. So these guys were very smart to encourage me to come and donate. It's difficult, I know, but once you've had COVID, it will be possible, of course, for you to travel once you've gotten well. And if you happen to be here, it is the perfect thing to do. It is a good opportunity when you're visiting and reconnecting with your family after having gotten well to make that donation. Yes.
Thank you, Eugene. Thank you, Lori. We are going to be in Hilo January 19th through 22nd. 21st. So we're going to be in your neighborhood very soon, Hilo.
Just a sound thing real quick.
You are unmuted.
Okay.
LG, you may want to repeat that.
Okay, so just to let you know, Tiffany, we will be in Hilo January 19th through the 21st, so in your neighborhood. And then a word from our neighbor from the Big Island.
Tiffany, forgive me for repeating for others, but I was lucky enough and still consider myself to be a Big Islander, so I certainly was one of the Big Island donors for Blood Bank of Hawaii. And as we come back and are reunited with our families after having been sick, what I was recommending is we take that opportunity. We might be here just because we haven't seen people in a long time. Now that we're well, we should come and donate.
Do you want to go up there?
Yes.
What can for those who've been vaccinated donate?
Why can't they, forgive me?
Okay.
So yeah, oh, okay. I'm going to go to our technical expert here.
Yeah, I can answer that really quickly. So we are in such a fast-moving world. The data, the Food and Drug Administration really likes to rely on data. And the emergency use authorization was based on a specific study. And that is the EAP study that all of the hospitals in the state of Hawaii were a participant in. That study happened before vaccines were available. Now that vaccines are available, the FDA has told all of us in our community that it would like to look at some of the data on what happens after a CCP donor or a person who's recovered from COVID-19 who gets the vaccine, and it's perfectly healthy for them, it's safe for them to get vaccinated, by the way. What happens to their convalescent plasma once they've gotten the vaccine? So the FDA and Dr. Peter Marks, who's the commissioner of the FDA for blood, has told us that they're not saying no, but they are waiting to see more data before they make a decision. Here's what I do know. What I do know is in Canada, CCP donors who have received the COVID vaccine are eligible to give CCP. And in some countries in Europe, that is also true. So right now, the FDA is waiting to get data, but I'm very hopeful that in the future, once that data starts to become available, that FDA will be able to say yes.
Can you add to that, Dr.?
So I would echo what Dr. Nguyen says. We're of every optimism that we will be able to ultimately donate CCP once the FDA approves it, in spite of being vaccinated. But what they're doing right now, and I've spoken with some of the leadership at both the FDA and CDC, is that they are studying very intently what the profile looks like of all of those who have received the vaccine. And that applies to whether or not their plasma with the convalescent plasma with the antibodies is okay. They're also studying whether or not we still have any capacity to carry the virus after being vaccinated. So there's a 3-month study going on right now across the country, in fact across the globe, to assess all these questions. This is a rare situation where we have essentially a new disease. We go all the way through to a vaccination within 10 months, and we ask to continue all of the treatments that we've developed. An extraordinary circumstance, I would say. So We hope to, in the next couple of months, be able to, again, be more flexible.
Thank you, Lieutenant Governor. I also want to say that, on behalf of the Hawaii Convalescent Plasma Coalition, I just want to reassure you that we have partners within the coalition who are participating. In fact, they are providing some of the research data in the study that Lieutenant Governor just mentioned to you. Clearly, he's in the know at the highest level of government, but also to let all of you know that some of the scientists who are involved in these studies are also friends of the Hawaii Convalescent Plasma Coalition. So I'm very, very proud that Hawaii has partners at these levels.
Nobody has a question in the chat, but if you want to unmute yourself, if you had a question, you can do so now. We'll give you a moment. If not, we will say concluding remarks. Okay.
Okay, so just a quick concluding remark, and I'm going to read a quote from the New England Journal article that was just published about a week and a half ago. And this article quotes a randomized controlled trial of convalescent plasma, and it showed early efficacy preventing severe COVID disease when convalescent plasma is used in hospitalized patients early. And it basically says super donors could contribute to build a therapeutic arsenal. This simple and inexpensive intervention can reduce the demands on the healthcare system and save lives. Convalescent plasma can provide a bridge to recovery for patients until vaccines become widely available. And I think that says it all. So again, thank you to our partners. Fight COVID with COVID, and please check out bbh.org. Thank you.